And welcome back. We have a treat this morning. We have the Primary Care Urgent Care is a new business, and y'all all know that we like to bring on new businesses. Our job as a community television station is to let you know what is happening in your community. New options, new businesses, and we have another one here. And I'm so glad to say, Nashville, you're so lucky. You're getting everything else. You might as well get an urgent care, right? So Nashville is just growing by leaps and bounds. So anyway, Primary Care Urgent Care is a brand new urgent care, primary care, as it says, that's come to Nashville. It's on, well, tell them how to get there. In a minute, we'll tell them how to get there. But anyway, this is Dr. Emanuel, and this is her husband, David Jernigan. Am I correct?
Correct.
Everybody knows you, I'm finding out, but me. I said, you know what, I'm the only one in the world that didn't know Dr. Emanuel, because everybody just speaks so highly of you. They really do.
Oh, thank you. I've been in this community for 18 years, and I plan to retire from here.
Mm-hmm.
I started out straight out of residency in 2005 with Eastern North Carolina Medical Group, and that's where I was up until June 16th of 2023.
Well, I understand that this is your dream, to own your own practice, and it has come true.
Yes.
So tell us a little bit about how that happened, how you arrived.
Okay. Well, it's always been my dream to be a doctor. My mom and dad bought me a Fisher-Price doctor kit when I was 2 years old.
Oh.
And every person in our household was a patient.
Okay.
So everything I've ever done was for the goal of becoming a physician. When I was younger, when I was 9, my brother had Guillain-Barré at 18 months, youngest patient at Duke at the time. So my mom and I cared for him. He had to learn how to walk, talk. We had to feed him, everything. It was a long recovery.
Mm-hmm.
And so that sort of solidified my decision to be a doctor. Of course, it wasn't the easiest path because I didn't get in straight out of undergrad. I decided to do an MPH in public health. Spent a year up in Boston University going to school there, only to realize I needed to come back to North Carolina. So I transferred to ECU, Brody School of Medicine, and did my medical school there. Went to Richmond, Virginia, did a combined program in internal medicine and pediatrics.
Wow.
Wanted to come back to North Carolina. This is my hometown. I was born in Lumberton, North Carolina, was raised in Durham. So family was here.
Right.
So wanted to serve a rural community and really wanted to serve a Native American community, given that I'm Lumbee.
Sure.
So I looked up and down the 95 corridor. We have a large Native American population here, the Halawasa Pony. I looked at the Waccamaw Siouan and the Coharie area, and then of course Lumberton, and we finally landed in Rocky Mount.
Well, we're glad you did. So you landed at a practice here.
Correct.
That you were at for quite a while.
18 years.
Well, that is quite a while. And you just decided you wanted to be in practice for yourself.
No, I came to that realization after the acquisition of our practice in 2020 by UNC Physician Network.
Okay.
I had been in private practice for 15 years, had grown accustomed to being able to make the rules and see patients on my terms. If somebody was sick and needed to come in, they could come in. If I needed to make a house call, I could make a house call. If they needed to come in after hours, I could bring them in. If they needed to come in on a Saturday to get a shot, they could come in. It's a little different when you're in academic medicine.
Mm-hmm. Absolutely. We as patients, Dr. Emanuel, feel like now it is a numbers game. A physician has to see, in the corporate world, has to see so many a day. So we feel like we're a number, sometimes. So now that you're in private practice, you're not going to say, I've got to see this many, so you only get this amount of time.
I've always believed that every patient deserves the adequate amount of time to address their needs, whether it be 20 minutes, 10 or 15. If it's a earache, I don't need 20 minutes for an earache. If there's more things involved and more in depth, then I need longer time. I've had a patient take as much as an hour. I don't advocate that on a regular basis, but
Right.
if it happens, it happens. So.
Right. So you're going to give the patient ample time to address their situation.
Correct.
That's wonderful. Well, tell us about the practice. It's kind of exciting, you know. I was in a business meeting yesterday, and Dr. Manuel was the speaker and her group, and we have the whole crew in here today. We're so excited. We're going to show you the whole staff, and you are so blessed to have. You have put together a wonderful team. You really have, and you know, bless you for that, because it's hard to get providers, and you've really put together a good team.
So we are predominantly we're primary care and urgent care, as the name specifies. I'm going to do predominantly primary care because that's what I've done for the last 18 years. So that's from birth to death, newborns all the way up until elderly. I also am a hospice medical director out of Wilson, and I'm a director for 2 long-term care facilities in Scotland Neck.
Right.
So I have a little bit of variety in what I see. I have 2 providers, a nurse practitioner and a PA, of whom you'll meet later, that are going to staff my urgent care and also fill in the gaps in the primary care. And then, of course, if I have a 2-year-old that has an earache and I need to go over to the urgent care side to see that child because they've seen me all their life, then I can just walk over. There's no boundaries. We have our office is free-flowing in the back. It's 2 separate waiting rooms because we're really going to try to keep well patients on one side and sick patients on the other. But in terms of the back, we can just walk in between. So I have picked out, a perfect PA that I've known for the whole time I've been here, and he's got over 40 years of experience. And then my nurse practitioner is new to this area, but she was my student for almost a year. She did all of her clinicals with me.
Right. So if someone needs a primary doctor, if they don't have a primary doctor, they can come to you. It's not just for urgent care. It is exactly what the name says.
Correct.
Primary care, urgent care. If you don't have a primary provider, Dr. Emanuel will be happy to see you. Is that right?
That's correct. We're accepting most of the big plans: Medicare, Medicaid, United Healthcare, Blue Cross Blue Shield, Cigna, Aetna, TRICARE. I know I'm missing some, but we have over 13 plans that we're accepting.
Wow, that's great. And where are you located?
We are across the street from Ribeyes in Nashville, behind Bojangles.
Very good landmark.
Yes.
I think everybody knows Ribeyes. Well, that is great. Very easy access to get to in Nashville, but it's not just residents of Nashville. You will see anybody in our region. Is that correct?
Anybody that wants to come to our facility is welcome. I have patients that travel from Durham that have said they're going to continue to see me. I have patients from the Outer Banks, from Beaufort, Manio. I used to have somebody that came from Virginia, but I think she finally found a primary up there. But
Well, I understand that you make house calls. Now, folks, this is unreal. This is unreal right here. I know that you made a house call to a friend of mine a few days ago, so she really does do this. But I was amazed yesterday when you said you will make house calls if there's the need.
If there's a need. I do realize that we have some elderly in the community that are not able to get out. And not even elderly. I have a set of young men that have muscular dystrophy, and they're challenged by getting out. One cannot come into the office anymore. His younger sibling can still come in his wheelchair, but as they progress with their disease process, it's going to be more and more difficult for them to get into the facility.
Sure.
But I used to do that under Eastern. Not a lot of people knew that, but I did.
Oh, really?
Mm-hmm.
Okay. Well, that's good to know, because like you said, there are reasons why, maybe not just elderly, but there are reasons why you may need they may need you to come into their home. So
Correct.
We're so glad to know that you do that. Now, your facility, I understand, has state-of-the-art equipment. Your x-ray machine, you were talking about that yesterday. Address that.
So our facility is brand new, which
Yes.
is why we're not exactly sure when we're going to open, because it all is contingent on construction,
Yes.
and things can happen. We had initially thought we could open July 5th, but looking more like the 17th. But we have a brand new lab, brand new X-ray. We're going to be able to do some in-house labs like a CBC and A1C. As the practice grows, we will add in chemistry and lipids. So
Patient portal.
we'll have a patient portal.
Okay, so you can go in and actually that is talking to your doctor, getting your computer and talking to your physician, and you will email back.
Correct. But also,
A lot of people may not know what that
I
is.
know,
so-
but also a lot of our elderly and a lot of our community, they really don't know how to access the portal, or they don't have the means and ability to do so. So we still will answer the phone. You're not going to get shipped around the country to somebody sitting at home answering phone calls that does not know who Dr. Emanuel is and doesn't even know if Dr. Emanuel is a man or a woman.
Right. Well, very good. Dr. Emanuel, I am so excited for you and your husband. Evidently, talk a little bit, David, about your support of what she's doing and that kind of thing.
Well, first of all, I think it's just easiest and best to say that if the golden rule, if mama's not happy, nobody's happy.
Right.
And so when she, for years under, as she mentioned, Eastern, she was working a lot of hours, but it's again, as another saying, if you're passionate about what you do, if you love what you do, you never work a single day, right? And that was really, you saw it many times as you see many people doing their professions. You may get tired in it, but you don't get tired of it.
Right.
And with what I do as in my profession, I'm in sales, and so I travel around to a lot of different doctors' offices around Eastern North Carolina. And I have since 2004, so roughly, going on 19 years. And, it's just getting harder, Sandra, for the independence, if you will, to stay independent. And I understand the reasons why. We don't have to necessarily go into all that, but just the high level of it is, insurance reimbursements are going lower, costs are going higher. So it's just getting harder for the independence to sustain. And so you see a lot of the, hospital networks, the large networks come in and, buy them out. And, but in Eastern North Carolina, that may not always be the best thing, right? It may not always be the best fit.
Right.
And is getting more and more of. You don't see people going into the individual private practice. So
Right.
I think it's a great fit.
Yes.
For this community, because Rocky Mount, it's not a big metro. It is a smaller city. Certainly, you have the little town of Nashville, if you will, and the surrounding communities also, which are small. So I think it's just a win-win. I think it's a great fit for the patients. I think it's a great fit for the staff, and I think it's a great fit for all the surrounding communities.
Sure.
So just super excited that she can and we can and all of us can, embark upon this opportunity. And as you'll find out more and more, as hopefully Wayne and Julia have an opportunity to talk a little bit about their background and what they're bringing to the table, to understand why, she, myself, Clementine, also we call her Sparky. Y'all don't know that. We call Clementine office manager Sparky. Yeah, you'll find out. Stay tuned. You'll find out.
You will.
But everybody here was handpicked. That may sound a little corny, if you will, but truly they were. It wasn't that we were posting positions online and people were just applying, because that was not the process. It was, okay, if we're going to do this, let's start out on the right foot. Let's start out on the right track, and let's get the right people in place. Right? Because it's a brand new business, even though she's been here for 17 years and she already has a lot of the patients, obviously that I'm sure we're going to establish with her.
Sure.
It's still a brand new entity. It's still a brand new business, and you want everything from ground one to start off on the right foot. So that's what we're bringing to this community. That's what they're bringing to this community, and that's what we're hoping. And I want to say this, because I don't know if this is going to be presented or not. So I want to make sure that you, the community, the public, knows this, that with the urgent care piece of it, that whatever your primary care copay is to see your primary care physician, if your primary care copay is $20, if it's $25 to see Dr. Emanuel, then it's going to be the same copay for the urgent care. We're not upcharging like a lot of the urgent cares, and if you go to the ER, you may have a $50, $60, $75 copay. That is not going to be the case because it's not your fault if you're sick.
Right.
It's not your fault if you can't get in to see your primary care provider. So why are we going to upcharge you for that?
Right.
Right? It just doesn't make sense.
That's very good. That is good.
You know, it doesn't make sense. So we want you to know that if you have a primary care provider elsewhere and you're comfortable, hey, that's fine. But if you need to come to an urgent care, then again, come to our urgent care. We love for you to come and know that you're going to get the best care possible, and know that that's going to be your copay, whatever your primary care copay is going to be. So,
Okay.
So we're super excited, and thank you.
Well, thank you for being on, Dr. Emmanuel, and we will be right back with you. We're going to take a break, come back, and we're going to meet the FNP and the PA right after this. Welcome back. We enjoyed our segment with Dr. Emmanuel and her husband, and now we're going to talk to two other people handpicked by Dr. Emmanuel for her team, Wayne Tamborelli, and you are the PA.
That's right.
And Julia Kern, and you're FNP certified.
Yes.
Okay, wonderful. And you will primarily be handling the urgent care.
Yes, I'll primarily be handling the urgent care as well as primary care patients who would like to establish full-time care. You may
Sure.
come into our practice with finger pain or an acute injury, and we want to offer you the ability to establish primary care as well.
Okay? And, you know, some of the patients you see in the urgent care may say, I don't have a doctor. I don't have a physician.
That
Yeah,
happens a
so-
lot.
I'm sure. I'm sure it does.
And if you provide quality care, they like it and they will come back.
Right. So what will the experience be like if we go, are we going to have a long waiting line and all of this when we go to your urgent care?
Well, hopefully not. I mean, that's the whole term besides urgent, you know. We can never tell if there's going to be 22 people in the lobby wanting to be seen
Right.
at the same time, and it may not be immediate care, but we will be doing the best we can to get multiple people in different rooms and be seeing a few people at a time to keep the flow going and moving more quickly and efficiently. But we won't do that at a sacrifice of the quality of care that we're going to give people. We're going
Sure.
to make sure they get whatever attention they need for their illness or their injury.
As we said earlier, you will get your time to address your situation.
Always.
Yes. So tell us a little bit, Wayne, about your background.
Well, I started out many years ago in nursing, and then transferred over to being a PA. Went to Albany Medical College in upstate New York, and then 50 years ago moved down to North Carolina. So I don't consider myself a New York boy. The town I grew up in had 50 people, so I don't really claim that much. But I've been working for the last 21 years in Roanoke Rapids. I started out at a urgent care, but as we just discussed, I developed so many primary care patients from that I was invited to join a multi-specialty group, and I brought all my patients down there, and I've been there for the past 18 or 19 years. And then when Dr. Emmanuel mentioned the opportunity for me to come and join with her, I just thought that was an opportunity I couldn't pass up.
Right, right.
We've been friends a long time, and I've known David even longer, and they're the most beautiful people in the world, and I'm just thrilled at what we're going to be doing.
Well, that's wonderful. Julia, what about you? What is your background?
So my experience is primarily in critical care. I have 10 years of emergency room trauma experience.
Oh, wow.
I went to school in coastal New Jersey. I went to Kean University and got my bachelor's in science and nursing. I then moved down to North Carolina and had some great opportunities with some of the larger health systems in this area. Was able to work at many of the emergency departments and really get some wonderful experience and learn about the community of North Carolina. Was then going back to school to get my family nurse practitioner from Chamberlain University, which is located in Chicago. Living in North Carolina, having to find a clinical site with a preceptor and a trainer, I stumbled upon serendipitously Dr. Emmanuel in her office and her
Wow.
wonderful staff, and she took me on as a student for a year, which was just a fantastic experience, seeing
Right.
rural medicine at its finest.
And that's where she was previously.
Yes.
Okay.
Yes. She has such an amazing following of patients that just absolutely love her. And she contacted me when she was formulating this wonderful opportunity to serve the community with primary
Yes.
care and urgent care of Nashville. And I was just so elated to join on the team.
It just sounds like we are getting some great experience in our community with this clinic. So now, give us the clinic hours, the urgent care hours. What are the urgent care hours going to be?
9 to 7, Monday through Friday, and 1 to 8, 8 to 1 on Saturday.
Okay, so you're gonna have Saturday morning hours. Okay, very good. And the primary care hours are
8 to 5.
8 to 5. 8 to 5, and then 8 to, for the urgent care, 8 to 7, 9 to 7 till 7 p.m. And then Saturday, 8 to 1. Very good.
I can say something about Julia. My wife, well, both I and my wife were Dr. Emmanuel's patients, but my wife knew Julia by name. When she was in there at one time, Julia was doing her training with Dr. Emmanuel and had such a good rapport with my wife that she remembered that name
Wow.
a long time later. So when she said, "Who's going to be the NP?" and I told her, she said, "Oh, you're going to love working with her. She's so smart. She's so nice." And she went on and on. I said, "Honey, I'm going to be working there too." You know?
That's
So-
funny.
And
She
Wayne
sees
just
you
brings-
every day.
And Wayne brings a wealth of experience and knowledge, and
Yes.
it's going to be a really wonderful team. And as Dr. Emmanuel and her husband David said, everybody has been handpicked. Very comprehensive care is what we're aiming to be able to deliver for this
Yes,
community.
it seems that way.
We don't want patients to have to drive all over the region in order to get what they need. The patients come first.
Wonderful. That is so refreshing to hear. We're going to bring the team on in our closing time. Let's just have everybody come up. I'm going to show you all the staff. I'm so impressed with the staff. So we have to bring the staff, because you know what? Everybody contributes to a business, a practice like this. Everybody is a contributor. Wow, are y'all impressed yet? Okay, if y'all want to come right on in, right behind our chairs and kind of close in. This is the staff of Primary Care, Urgent Care of Nashville, North Carolina, y'all. So they're all here to meet your needs, and Clementine is the practice manager. She's hiding.
I'm hiding back here.
But you're the practice manager.
Yes,
And if you want to introduce just by name, your staff,
Okay,
your team.
Absolutely. What I'm gonna do is just let each person name
Okay,
what they do.
okay.
Let's start with you first, Lindy.
Okay. I'm Lindy Bedlin. I'm the Director of Nursing for Primary Care, Urgent Care of Nashville.
Wonderful.
I'm Amanda Webb, and I'm a CMA,
What is a CMA?
Certified Medical Assistant.
Okay.
I'm Jairus Neal, and I'm going to be doing reception and insurance.
Okay, very important. Okay.
I'm Kathy Raines, and I'll be doing front desk reception.
Okay.
Kristen Edmondson, and I'm a CMA.
Okay.
I'm Mandy Daniel. I'll be in charge of the lab and x-ray.
I'm Kayla Whitman, and I'll be doing X-ray and labs.
Okay. And of course, Dr. Emmanuel, her husband David, and then we have one on the end.
Oh, I'm Ernestine Perry. I'm CNA and PCT.
And as you can see, they're very dedicated because they got out of bed very early this morning to be on television. They rallied the troops. So we're going to look forward to your practice opening somewhere around July 17th maybe, as soon as the construction ends. But they are located right in front of Ribeyes. If you go to Nashville, you pass the courthouse. Keep going until you know where Nashville is. Turn left by McDonald's, Ribeyes. They're right there on the left, and Ribeyes is on the right. That's as good as I know how to tell you. So, All right, and Dunkin' Donuts.
Yeah.
They didn't
Yeah.
forget that because you know they'll all be stopping there on their way to work. So, anyway, we appreciate having y'all on this morning. It's been so enjoyable, and congratulations on your new practice, Dr. Emmanuel, and your wonderful team that you have put together, as I've said before. We'll be right back on the Don Bullock Chevrolet Morning Show right after this with the K5s.